Hi, I'm Tanya McCulloch, physical therapist here at Specialist Hospital. In this segment, we will be going over some exercises that will help prepare you for surgery as well as facilitate your recovery process. But before we begin these exercises, you need to be aware of some precautions that you should follow to help avoid the very slight possibility of dislocating your hip. Depending on the type of surgery you have and the condition of your hip, your surgeon will guide you on how long you should follow these precautions. The first precaution is to avoid bending your operative hip beyond a 90-degree angle. You may have to raise your seat by placing pillows into a chair, and you may also have to use an elevated toilet seat. You should also avoid deep squatting or bending forward at the waist to pick up items off the floor. The second precaution you should follow is to avoid turning in your operative leg in a pigeon-toed position. Keep this in mind when you are standing, lying down, and especially when going from a seated to a standing position. You may have to sleep with a pillow between your knees to help avoid this position. And finally, you should not cross your operative leg or ankle. While you're in the hospital, your therapist will review these precautions with you and help you establish safe movement habits. Now, keeping these precautions in mind, we will begin the exercises. Immediately following surgery, you can begin performing ankle pumps. You should point your toes downwards, then pull your foot back towards you, bending your ankle to move your foot up and down. Repeating this at least 20 times, several times a day, will help reduce the chance of having a blood clot after surgery. For quad sets, either lie flat on your back or sit in a reclined position. Tighten your quadriceps muscle on the top of your thigh. You should see your kneecap slide towards you. When you do these correctly, your knee should straighten and flatten against the bed. Each time you tighten your muscle, squeeze for 2 to 5 seconds, then relax and repeat 20 times. For this exercise, you should lie flat on your back. Squeeze your buttocks muscles as tightly as possible, holding the contraction for 2 to 5 seconds. Relax between contractions and then repeat 10 to 20 times. Heel slides are performed to help regain the range of motion in your hip. To perform this exercise, lie flat on your back on the bed or couch. Bend your knee as you slide your heel towards your bottom. Be sure not to exceed a 90-degree angle at the hip. Then slide your heel back down to the starting position. Repeat this 10 times. Bridging is an excellent exercise to help increase the strength in your hip muscles. Lie flat on your back with your arms at your side. Bend both knees and place your feet flat on the bed. Lift your hips up toward the ceiling as high as you can, pausing at the top. Then slowly and controlled, lower your hips back down to the starting position. Repeat this 10 times. For short arc quads, you will lie flat on your back and place a bolster under your knee, causing it to bend just slightly. You can use a coffee can or rolled towel. Extend your legs, straightening your knee. Pause at the top, then slowly lower back down to the starting position. Repeat 10 to 20 times. This hip abduction exercise is done in a standing position with your hands supported on a high surface such as a countertop or the back of a tall couch. Keep your knees straight and toes pointing forward. Raise your leg out to the side. Keep your body upright. Do not allow your trunk to lean to the side. Lower your leg back down and repeat 10 times. This hip extension exercise is done in the same position as the standing hip abduction exercise. Place your hands on the countertop for balance. Keep your knees straight and toes pointing forward. Raise your leg behind you and then slowly lower to the starting position. Make sure you stand upright and do not allow your body to lean forward. For this exercise, you will lie on your non-operated side with pillows between your knees. You may want to bend the knee on the leg underneath for balance. Keep your knee straight and toes facing forward and lift your leg up 6 to 8 inches off of the pillow. Return to the starting position and then repeat 10 times. For prone hip extensions, lie on your stomach on the bed, allowing your foot to hang off of the edge. Tighten the muscles on the back of your hip. Keep your knees straight and lift your legs 6 to 8 inches off of the bed. Return to the starting position and repeat 10 times. For this exercise, you should sit in a chair with your back against the chair, paying attention to your hip angle. Slowly extend your leg until your knee is straight. Hold this position for 2 to 5 seconds, then return to the starting position. Repeat this 10 to 20 times. Finally, strengthening your arms before surgery is an excellent way to prepare yourself for using a walker or crutches. Sit in an armchair, making sure your hips do not exceed a 90-degree angle. Place your hands on the armrest and your operated leg out slightly in front of the other foot on the floor. Then straighten your arms, trying to raise your bottom up off of the chair as much as possible. Slowly lower yourself back down to the starting position and repeat 10 times. Performing these exercises before surgery will give you an added advantage to a successful recovery following your total hip replacement. After surgery, these exercises, along with a regular walking regimen, will help you achieve your maximum potential.